Jane. My name is Sarah, and I'm going to be your nurse today. The doctor has an order to put an NG tube in, which is a nasogastric tube. It goes down your nose, and it's going to suck all the contents out of your stomach to help relieve that abdominal distension that you have going on, okay? Alright, and I have all my supplies right here. I have the tube, I have an emesis basin in case she throws up. I have the syringe, some tape, a clamp, which my tube doesn't need it because it has its own thing there. I have a marker to mark the spot that I need for the length, and I have some lube and a pen light and a tongue depressor to check her gag reflex, and a cup of water so she can swallow to assist with putting the tube down her throat. So, alright, I put gloves on first things first. Alright, Jane, we're gonna put some washcloths on you in case I make a mess, okay? And then here's this in case you do throw up a little bit, okay? And then this tube, when it goes down, it's going to be pretty uncomfortable, okay? But it shouldn't hurt any. If I go too fast though, just raise your hand to tell me to stop, okay? And I'm gonna have you drink this water while I put the tube in your nose, okay? This is the tube I will be using. See, as I said, it has its own clamp thingy here, so nothing will spray out on the bed. And before we put it in, I'm going to measure how long exactly we'll need to put it in, okay? So I would start from I would find the xiphoid process. I'm gonna feel around on your chest, Jane, okay? And it's about right there. And then start there. And go up around her ear. And then I would stop at her nose there, which is around the 55 mark, 54, 55. So I would hold that spot with my finger. And I would take this marker and I would mark a little mark here so I remember where exactly it is. Alright, and then I would prepare some tape to tape it to her nose. And that would just tear in half there. And then, you know, normally we would safety pin it to her gown, but we don't have any safety pins right now, so I'll just prepare a few more pieces of tape just to tape it around her ear, which also can be done too instead of the safety pin. Alright, and then before I would even attempt to put the tube down her throat, I would check the patency of her nostrils. And they both look good. I don't see any deviated septum or anything like that. Have you ever had any facial trauma, Jane, that would contradict an NG tube? She says no, so I'm good to go there. And I'm going to check your gag reflex, okay? And the gag reflex is patent, so we won't have any issues. I mean, if it does go down the wrong pipe, she should technically start coughing, but other symptoms would be she would be turning blue, or her oxygen saturations would go down, or yeah, or something like that. And if that would happen, I would take it out immediately. Alright, we're going to lube up the tip of the tube here. Some lubricating jelly. Alright, and then before I would, Jane, let's drink this water while I would put this tube down, okay? And I want you to swallow on my command, okay? And we pretend that she's holding the water. Alright. In we go, Jane. Keep swallowing that water, okay? And we would start with the neck in the neutral position. And then as soon as I would meet resistance while still having her swallow the water, I would rotate the tube 180 degrees. And I would have her tuck her chin down. Keep swallowing that water, Jane. You're doing really good. And I would also check the mouth, make sure it's not curled up in the back of the throat. Alright, Jane, keep swallowing the water. You're doing so good. Keep swallowing that water. Keep swallowing. Keep swallowing. You're doing really good. Are you doing okay? Alright, she said she did good. So you did really good, Jane. And I would tape the tube to her nose here. Tape it in place so it doesn't fall out. And I personally would rather use a safety pin, but we'll tape it for now since we don't have any safety pins. Alright. And then before I would do anything with the tube, we would get an x-ray to make sure it is in the right spot and it is not in the lungs, because that is really important. And after x-ray would come up and get a picture of her chest, I would aspirate the gastric contents a little bit here. And then using my pH strips, the pH would be less than 5. But the x-ray is the only sure way to tell if it isn't in the lungs. Looks good. It is less than 5. And then we're gonna hook you up to some suction, Jane, okay? And I would hook her up to light intermittent suction using this guy. And you don't ever want it on continuous suction because that will irritate the gastric mucosa. Okay, and then after a few days passes, her bowel obstruction is relieved. We would go ahead and take the tube out. So Jane, we're gonna take your tube out now, okay? 'Cause you're feeling better, huh? And it is nothing like when we put it in. Taking it out is going to be much easier, okay? I can guarantee you that. And then before I would take it out, I would irrigate it with 10 milliliters of saline here. I'm not actually going to put water in the mannequin, but just pretend. Alright, Jane, are you tape off here. Just gonna be a little uncomfortable, okay? But it'll go quick, I promise. Alright, that was painless, huh? This tape's sticking to my gloves. Alright. And then aspiration precautions, I'm going to discuss those a little bit. For all patients, they need to be sitting upright while eating or doing mouth cares or drinking or anything like that, because laying down, if they're too far on their back, they could easily aspirate something without knowing it, especially those who have swallowing difficulties. And while they are eating or drinking, always assess for swallowing, and if they have trouble swallowing, refer them to a speech pathologist, or speech therapist, or something, so they can assess or if they need thickened liquids or modified food textures or anything like that.